In today's Eye on Health, we are talking about something serious and quite honestly tragically sad. The infant mortality rate in the Black community here in Pittsburgh is a real cause for concern.
Yeah, any number over 1, of course, is too high. But a yearly report reveals that, sadly, the numbers are alarming.
Mikey Hood recently sat down with a woman who has had 2 very different experiences when it came to childbirth. Telling her story was so important that she met up with Mikey just 1 day after giving birth to her second child. Her story is today's Eye on Health.
Yeah, my first experience was, I'm now realizing, a bit traumatic. I think when it first happened, I didn't really see it that way. I kind of listened to what a lot of the doctors said, which was, oh, it was normal, it wasn't a big deal.
Crystal Edwards, now a patient at AHN, just successfully gave birth to her second baby. But the experience giving birth to her first baby at a different hospital system wasn't so good. According to the most recent Equity Indicator report, infant mortality rates for Black women are high. Dr. Margaret Larkins-Pettigrew with AHN says it's a wake-up call.
And so we are about 15 per 1,000 death of babies just in our county. That's compared to white women. That was about 4, I believe, per 1,000 babies. We know that if we decrease the death of Black babies, we decrease the death of all babies.
She says structural racism is at the core of the problem.
And really realize that women are experiencing obstetric racism where they're not listened to, where they are not partners with their clinicians. That's one of the biggest ones. But the other one, of course, is preterm labor and very preterm labor. That happens often in Black mothers. Why that happens, many complicating issues around why that happens.
During her first experience with childbirth, before Crystal went into labor, she was 5 centimeters dilated. Her doctor told her when she started to feel contractions, there would be a room ready for her.
When I got to the hospital, that was not the case. I was stuck in triage until I was ready to push. I was fully dilated, and because I wasn't in a labor and delivery room, I didn't have the full epidural. And I would tell, the nurses and the doctors, like, I'm still feeling all the contractions, but I can't move. And that was really uncomfortable for me, not really being in control of my body, not being able to walk through my contractions and not knowing I was gonna be confined to the bed. And so it wasn't until I was already ready to push that they wheeled me into labor and delivery. And by then the epidural had, of course, worn off. And now I'm feeling all the pains of labor. And it was just a situation where I felt like I wasn't listened to, that I wasn't fully informed of what was happening, and just had a lot of trauma with the whole experience afterwards.
This time, Crystal is now at AHN, and Dr. Daniel Smith-Lubby, an OBGYN at AHN, created a plan for her from the very first visit.
Part of the poor health outcomes the Black women experience have a lot to do with not being heard and seen and really engaged with on the part of their providers. I think it's important to find someone that you feel like you can have an honest conversation with and share what your experience has been.
Addressing past traumas can help women have a better pregnancy experience too. The First Steps and Beyond program at AHN was formed to help families through the process.
Everybody who touches a mother from preterm on to say, how do we make this journey the best journey they can have? How do we pay attention to them? How do we educate ourselves about obstetric racism so that it doesn't happen? How do we really make sure that this process is one that ends very positively for more Black women and babies? And I think we're on the right road. In fact, I know we're on the right road because this is going to work and it's already started to work for us.
Crystal's experience at AHN was very positive. She felt like she mattered.
I can see that she was properly cared for and that she was listened to when she was supposed to, instead of it being too late.
This is Kalen. He was born yesterday, 8/21 at 1:12 p.m. He was 8 pounds, 6 ounces, 21 inches long. So he's a big baby. As I'm walking around pregnant, I could tell, I was like, this is gonna be an 8-pound baby. I kept telling my husband, I'm like, I know he's gonna be huge.
Birth is unpredictable. No one has a crystal ball. No one can say how it's gonna go, but you want to know that the color of your skin should not impact your outcome.
It is so important and to be heard. That's the message that I kept hearing through all of that. You need to be heard. You need your doctors along the process, because anything can happen, from preeclampsia during your pregnancy to any number of things, and to make sure that you're getting that best care leading up to that and after is so important.
And I love that we heard a positive message there, that things are improving, and that's so very important. And remember to keep watching Eye on Health, our Eye on Health series right here on PTL. It happens on Wednesdays, and it's brought to you by Highmark Blue Cross Blue Shield, together with Allegheny Health Network, for your health.